This is my dad, and last year, he underwent a full anatomical shoulder arthroplasty, as well as many other procedures, including a full rotator cuff repair using the push lock, and a bicep tenodesis procedure using the swivel lock. The first medical device that I'm going to be talking about is the swivel lock. This comes from a family of different medical devices that are all used in order to repair bicep tenodesis in many different forms. This is just one of the tools used in my dad's surgery to repair his entire left shoulder. So, in my dad's surgery, he actually got it on his left shoulder, but our friend here lacks that half of his body. So, we're just going to show you how to do it on his right shoulder. A surgeon's first step in this procedure would be to uncover the bicep tendon. After uncovering this bicep tendon, you would prepare it and then afterwards load a stitch into the junction of the bicep and complete a baseball stitch all the way up until you reach the site of tenodesis. That's when you load your suture into the swivel lock, as you can see here. And then you would locate a piece of the humerus and you would drill a hole using a 5.5mm reamer, and you drill that hole right into the bone, and that is when we break up the swivel lock. They will take their swivel lock and they will reattach it after it's already loaded with the suture. They drill it into the hole that they've created, assuring that the biocomposite is the same millimeter width, and then they screw it straight into the bone, and the biocomposite sits into the bone, and they're sutureless locks, which has a large advantage that we'll get to later. After speaking with Karen Gallen from Arthrex, I'm going to show you guys exactly the engineering process of the push lock. Medical devices are often prompted by surgeons who have found a slight issue when they're performing their surgeries. They then find an engineer who will take their talents to a CAD website or 3D engineering and begin modeling their device. One of the essential components to an Arthrex device is a biocomposite. These tiny but mighty inventions are very useful in many reconstruction procedures. These little screws are made out of an absorbable composite interference, and they are used in many graft fixation procedures, including PCL and ACL reconstructions and many arthroscopic procedures. The real formula is a biocompatible polymer mixed with the bioactivity of a ceramic, not that kind of ceramic. These screws are tested thoroughly before using in any patients, mainly on cadavers or animals. The knotless suture anchor is key to improving the well-being of the patient right after surgery, and they eventually dissolve into the muscle, but it's so amazing to leave extra space in the cavity and prevent a lot of irritation in surrounding tissue. Thank you to everybody at Arthrex, and I hope you enjoy!